You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, she says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. It's the hottest trend in dentistry, and with us we have an expert on the topic, Dr. Amanda Sheehan. Dr. Sheehan, welcome to the program.
Thanks, Randy, for having me.
Now, before we get into today's topic, and I know you brought a lot of photos, so we'll get to as many of those as possible, but who's the typical dental implant patient that you see?
So the typical dental implant patient is a patient who hasn't been to the dentist in quite some time. They have bleeding gums, they have teeth that are moving around, teeth that are spacing, teeth that are flaring, or teeth that have cavities, black spaces, teeth that are, not too healthy. And most of these people are, heading towards dentures, and they're afraid of dentures, and they don't want dentures, and so they come to me so we can make sure we get their teeth that are going to be locked in their mouth so they can eat and chew and be happy.
All right. Now, the second group you say are the denture wearers.
Oh, yes.
But they're tough to get in.
Now, the second group are denture wearers, and those people are tough to get in because a lot of them have kind of fallen off the system because they didn't realize there were better options.
Now, we should mention, we're talking about dental implants today, but you've had a lot of training, like I guess over 1,500 hours of continuing education on dental implants.
Well, yes, Randy's closer to 2,000 now. But
okay,
yes.
And you teach other dentists about dental implant dentistry.
I teach with the Mish Implant Institute, which was one of the original institutes that taught dentists how to do implants back in the 80s. In our industry, I've trained under some of the major legends, and now I'm helping and teaching other dentists how to do the surgeries. I've been to Cuba. I was actually the first group of American doctors to go to Cuba to train not only the dentists there, but other American dentists on how to do implants.
So is this the future of dentistry, like where dentures as we know them today, like let's say 10 years or 100 years, everything will be attached to implants?
Absolutely.
Is that what you believe?
Oh, absolutely. I mean, in my prediction will be in 5 or 10 years, people won't wear dentures at all. So in my office, that's actually our standard of care. We offer implants to everyone because I don't feel like anybody should be suffering, walking around, not being able to chew and feel comfortable. Dentures are moving around. We want to snap them and keep them tight.
Okay, good. Now, you've always liked teeth. Your mother's your office manager. I met her before the taping in our green room.
Yes.
And she said, like at 14, 15 years old, you already knew you wanted to be a dentist.
It's quite embarrassing, but I used to take paper clips and bend them and make retainers. I've always had a strange fascination with teeth and how to make them look good and move them and everybody smile. It's the first thing that I see when I look at somebody. And I'm always, kind of looking at them, what I can do to make their smile better. And
okay, now your mother.
Yeah.
She's a patient of yours. You said that she didn't like her smile. You didn't like her smile, but she didn't want to do anything about it. Tell me about that.
So my mom is one of the typical patients who hates going to the dentist. She's a dental phobe. She used to tell stories about being a child and having to go to the dentist every other week practically. And so, when I went to dental school, I started learning more about teeth and I said, Mom, let me see your x-rays, and I said, gosh, Mom, we really should do something about your teeth. She was cover her mouth when she was talking, never really felt comfortable. And she says, oh, I don't want to do anything about my teeth. And at the time she was living out of state. Well, now she's in the office with me, fast forward a couple years. And I said, Mom, we have to do something to help you. And she says, okay. And I finally get her in the chair. And now, the smile transformation's been amazing. It's brought her back.
She says patients will actually say, I want teeth like that.
Oh, that's very common. They come
look
in
good. One of the first things I noticed about her, and you said you were bringing your mother to the studio, but she didn't seem like your mother because she had this youthful, I'm trying not to exaggerate either, but she seemed like very young with these teeth.
Yeah, my whole goal is to make something that's natural and that's going to look really great with the person. So, you want to make sure that the smile fits their face too. And so,
even with implant dentistry, you're making it look real, look good?
I don't want someone to come up to you and say, gosh, did you get your teeth done? No, I want somebody to say, you look different, you look a little refreshed, something changed. That means I did a good job.
Okay, good. Now, where you are, in near Detroit, are there a lot of people wearing dentures? Is this a big problem?
Randy, you'd be shocked. So you could fill Tiger Stadium, 10, 20 times with the number of people who are missing teeth. Sometimes it'll be just one, but generally it's 6 or more. Dentures, top teeth, lower teeth, you'd be really surprised with how big of a problem it is. Within an hour of the practice, there's tens of thousands of people who are missing multiple teeth or completely in dentures or even worse, not wearing anything at all.
So if there's so many people in Detroit or in Michigan, period, that have an upper lower denture, why aren't they all running in or at least coming in to do it? What's your take?
So Randy, I have a lot of opinions about this. First is probably because the patients who are in the dentures, they don't even come into the dentist anymore. A lot of times they have these plastic teeth in their mouth and they think, I don't need to go. They come in maybe because they're getting a little loose, so they get, repaired with some more plastic. They get a reline. They're they're still not really happy with them. So they don't really even know that this is an option for them. The second is, a fear or phobia. These are the patients who feel like they've spent their entire life in the dental chair. Was it a root canal? Now I have a loose tooth. Now I have a cavity. Now I have a broken tooth. They've been back and forth a million times to the dentist. And, eventually somebody takes out all of their teeth and they're almost relieved because finally the pain is over. They don't have to keep investing all this money in their mouth, and they feel like they can finally be done. And so they have dentures. Now, people with dentures, those are the ones that we can help the most, because I know they can't eat and chew. They really can't even chew their teeth at all. They just kind of mush their teeth, their food back and forth, side to side. And so we can actually give them a snap-in set of teeth so that way they can go back to chewing, or actually a fixed set of teeth that don't come out at all.
Now, you say people with dentures don't really chew very well, like they can't eat salads.
Oh, Randy, I feel
meat.
like the people who wear dentures, they talk to me about they're eating, applesauce or mashed potato diet. They're not having cucumbers, they're not having carrots, they're not having all these healthy foods that they used to enjoy. Think about that, because the teeth don't come together properly. They sort of move side to side if they touch at all, and they can't really chew. Somebody said once, there's no teeth in your stomach. So how are you going to be able to chew something if you don't have teeth? So, being able to snap and make the teeth strong again gives them the opportunity to have real delicious food that they can chew properly.
Now, in your practice, because you've had a lot of training, we should mention, so I guess how implants are normally done is you go to one place that does the surgery, you go to another doctor that puts the teeth on top, and another place with the imaging. You do it all right there.
Yes.
So aside from convenience, what's the big benefit?
So the biggest benefit of it is, I'm with the patient from the beginning all the way to the end. Sometimes when you get so many people involved in a case, you lose sight of what the patient really wants and what they need. And so, if it's just going to be me, I'm able to monitor the patient, understand, listen to what they're really looking for, and use, multiple different things to make sure that they achieve the confident smile and are back to feeling like themselves. So patients love that there's just one person involved. So I'm actually able to pass the savings on to the patient. And in fact, it usually takes a lot less time because there's not communication with another office. There's not, having to go somewhere else, records getting lost, communication lost. It makes the treatment a lot more affordable and a lot quicker. So in Waterford, we have plenty of really wonderful specialists, the oral surgeons and the periodontists, and sometimes they come in and assist us with some of these cases, and they're wonderful professionals. But at times, when I'm able to take care of the patients all by myself, it's really such a valuable benefit to the patient.
Okay, good. Now, you say this is life-changing. I'm paraphrasing you slightly, but you say it changes their lives.
Randy, I think I'd have to show you for you to truly understand.
Okay.
You have to take a look at this gentleman.
All right.
He's actually a business owner.
Okay.
And he had said that he couldn't really chew that well. He was having pain. He was having bleeding gums. And his wife had been harassing him and telling me, "Listen, you really need to do something about this."
Is that true? I think you told me that on the phone, that sometimes the wives or partners or spouses drag them in. They're sick of the nagging, right?
Yeah, it's true, because we understand that, nobody likes to come and see us. But when you see somebody that you love suffering, you want to help them. And so a lot of times it's the spouse that's, the motivation
So
behind
this guy
this.
was headed for dentures.
100%. He was headed for dentures. But, we want to give him something more than that. So right now, I want to show you. This is his temporary set of teeth and the smile transformation.
Wow.
The goal is going to be, in the long run, to have him have fixed teeth so that way, they don't come in and out and he can chew. This is actually just, I think, 2 days after surgery. And you can look at the difference here. He had that beard that was...
He looks like he could be the son of the before photo.
What was
right?
interesting was, when he came in for his appointment, which was 2 days later, I wasn't in the office, so the girl sent me a picture, and I said, "Who's that?" And I looked at him closer. I said, "Oh my gosh, I know exactly who he is." You can see the difference. Look at his eyes. He's shaved off all of the facial hair. He's a whole new person. And what's interesting about that is 1 week later, he had his wife in the office because now he wants his wife to have the treatment as well. So Randy, look at the before and after here. Look how much younger he looks.
Yes.
Looks like he could be his son or his, distant cousin or something. When somebody's not confident with their smile, they do a lot of interesting things to try to hide it. Do you see how he had facial hair there that he was trying to cover his teeth, and now he's smiling right up in front and center.
Yeah. Now, one of the things we were saying that, and you were telling me in the green room, is that teeth could make you look more attractive. And this is a perfect example
Randy,
of that.
For somebody like yourself, you have a beautiful smile. Thanks. So maybe you don't know what it feels like to have, not be really comfortable or confident with your smile, but it is really affecting people's lives. And once you're able to regain that confidence, everything changes.
Everything changes.
Their personality, they come out of their shell, because instead of trying to, be worried about what somebody else is thinking about them, they're able to be their true self. Think about this. If you were in a room and you say you didn't like your nose, and you walked in, you said, gosh, everybody's looking at my nose. Most people probably are not looking at your nose, but they're looking at your eyes and your teeth, right? You would be not able to be your full self.
Okay.
So, when you have your full smile and you have your confidence back, you come out of your shell, you act,
It's like charisma is back.
You're your true self, truthfully.
You say people with bad teeth are like judged in a certain way.
We're in LA, right?
Yeah,
so
yeah.
You're
We're in
familiar-
San Diego, but
San
close
Diego.
to LA, right?
Thank you. Hollywood industry, this is an easy example for us. What do they do when they want to show somebody who's maybe not too smart or poor? They make them and they give them bad teeth.
Good point.
Yeah. Now, somebody who's well educated or very successful, what do? They give them a nice smile. So,
Okay.
there's the stigmatism around what your smile
Like
is.
even at Halloween, I was thinking about this when we talked on the phone. You want to make someone look dumb, they always remove the front tooth.
You're saying exactly what I'm thinking. So that the smile is the gateway to the personality. People are making opinions about you before even, hearing one word out of your mouth based off how do your teeth look and how.
But it's that fear of the dentist. Because
It's-
people don't want to see you, right?
You know what?
Did they say that to you? No offense. Because look, I know your age. You look even younger than you really are. But do you still hear that? Like, no offense, doc, but I hate the dentist?
On a daily basis, I always say that if I had $1 for every time I heard that, I could probably retire. But
Do you have a funny one-liner?
Yeah. Yeah. The thing is this, I know that nobody's comfortable coming to the dentist. I don't even like to have dental work done. I'll be very honest about that. That's why we try to make it as easy for the patient as possible. We try to listen to what their concerns are, see what I can do to help them, and do the best we can.
Okay, good. Now, you have more photos. What else are we looking
absolutely. Okay, this is an interesting story because his father was actually a dentist, and his father died about a decade ago. And he was just so upset with himself that he let his dad down, that this is how his teeth looked. And,
That's got to be unusual.
Randy, not really. So, generally what happens is when somebody has teeth that look like this, they do everything they can to hide it from you and from the public. Sometimes they don't even leave their house, but, they either frown or they, grow facial hair or
Can you spot this? Like being a dentist,
I see it from a mile away.
It?
I see it from a mile away because they won't look, they won't make eye contact when they're talking with you. They'll do some sort of hand gesture to cover their mouth. Sometimes they don't smile at all. They just look unhappy. And they're not really unhappy people. They're just people who are trying to not
hide
show their
teeth.
teeth. Exactly. Okay. So, he felt guilty, but, it's a bacterial disease. You can't brush and floss that out. And he says to me, as soon as he sits in the chair, he says, I bet you've never seen anything worse. And I said, I'll try me because I guarantee I have.
Okay.
So, I took one look at him and there was plenty of things that we were able to do to help him. Wait until you see this transformation.
Let's take a look.
Are you ready? Okay.
All right.
So,
I'm ready.
So this was 1 week later. He's still in his temporaries as well.
Nice.
And you can see that he's, look at his eyes. Look at how they're sparkling. How you can see. The first picture is not even like he's smiling. He's almost
grimacing. Like he's grimacing, yeah.
Well, when we asked him to smile, and this is what happens when somebody's not comfortable, and you say, "Can you smile?" They do this. No, they're not going to really show you their true, because they're not used to it. In fact, they have to reteach themselves how to smile.
How to smile. Now, do they start becoming irritating on social media, taking pictures of themselves?
I think they actually get defriended by some of their friends because they take too many selfies now.
Yeah, but what about if they have bad gums? Can they still get implants?
Well, Randy, those are the people that we see most commonly. So, of course,
they're ideal candidates.
Ideal. We have to clean up the gums, get everything healthy, but then those are the people who, need the most help, and those are the ones that we can do the most for.
Okay, so no more dentures, we said at the beginning. Do you think you'll wipe them out in Detroit someday?
You know what, one patient at a time, but that's definitely our goal.
Is that right? So let's take a look. What else you got going on?
Oh, okay. So here's another patient that was heading for a denture, and she loves to be social, but she hasn't been because she can't go out to eat. She really
Did they
can't.
tell you this on the consult?
Generally, yes. Generally, the consult involves, how their life has been affected by this. And that's why I feel so passionate about it, because it's amazing how when somebody can't eat and go out to lunch with their friends, imagine this, Randy. You are at a sporting event with one of your children, okay? And they say, hey, let's go down the street to go have some lunch or some dinner. And you have to come up with some excuse about why you can't go because you're embarrassed. You don't want to pull out your denture and, not be able to order. They're going to have corn on the cob, or they're going to have, go for salads or go for baby back ribs,
Or something chewy.
something that you can chew, but you know that you can't eat that because
So they avoid going out.
So they go and this is things that I hear every single day because it affects their their social life as well because they don't want to have to go into the restroom, take out their teeth and clean it. That's embarrassing.
So with this woman right here, so she comes in, were those the only teeth she had left?
She had some dentures that really weren't fitting her well at all. And, and her doctor had said, you really try to, need to take care of yourself, eat healthy. And she's trying to, do everything she can. But how is she supposed to eat healthy if she can't chew?
Okay.
So she came into the office and in one day we gave her a full set of fixed teeth, upper and lower.
That don't come in and out.
That
Let's
don't
take
come
a look.
in and out.
Let's take a
now
look.
again, this is her and her temporaries. That's 1 week later.
She's already smiling.
She's already smiling. Well, that's what I was telling you before too. They have to retrain themselves to smile because they're not used to smiling. To get a picture like this, even to start with, I mean, I think the girls, had to spend 10 or 15 minutes to get her to even really open her mouth and show what she had.
Now, when they do this, they're taking oral, because it doesn't hurt during the procedure.
No, of course not. So we have different levels of, sedation that we offer, whether it be oral sedation, nitrous. We make sure that the patient's very comfortable.
So some people even take like a pill the night before. That's how scared they are of the dentist?
That's not uncommon at all, Randy. We do whatever we can to make sure that you feel comfortable, coming in for your appointment and that you're going to be relaxed.
How old can you be to get dental implants? Somebody watching this.
I actually have a friend who just treated a 101-year-old. And somebody would say
Why
to
would
me,
a 100-year-old do this?
I knew you were going to say that
Okay.
because you're like, why would somebody, but I'm telling you, he wanted to be able to eat his baby back ribs. And even his children were saying, well, why are you spending my inheritance? But people want to eat. That's embedded in our culture. So if you cannot have and eat things that you enjoy, I mean.
So if a 101-year-old could do it, like 80 is young to get
80,
this done.
Yeah, 80 is young. The typical implant patient is in their 60s, 70s, 80s. That's who we see. I mean, you don't typically see 20-year-olds with no teeth. You typically see mature adults with no teeth.
If everything works out, how soon can they eat after the procedure? They get their new teeth supported by dental implants. How soon could they eat?
We have some patients who are eating the same day.
Okay. They just have to what? Just kind of slowly take it easy, eat softer foods at the beginning?
Well, let me be honest. So if you had your knee replaced, would your surgeon let you go run a marathon the day that you had your knee replaced?
All right.
Probably not, right? You're going to ease yourself into it. But within a few months, once everything's fixed and sealed and healed, they can have whatever they want. They're eating corn on the cob, they're having apples, right away.
So they can bite, like let's say a carrot with their front teeth, or
Yes.
do they still have to be careful?
Well,
Like once they get their fixed set of teeth, they're all healed up, they can eat whatever they want?
I mean, I have some certain rules about whether you have teeth or implants anyways. You still don't want to bite a Jawbreaker or some Jolly Ranchers with your teeth. You want to be careful with,
All right.
those sort of things. But yes, you can, that's the whole point of it. Now, let me show you this next patient. She came into the office, again, kind of motivated by her significant other. And she was uncomfortable with her smile. She sat there and all she wanted was to feel confident again. And
Okay.
I said, I can help you. So with her, I couldn't save those teeth.
So they had to come out.
Unfortunately, they had to come out. But, the long-term goal is going to be teeth that are going to be staying in her mouth that are fixed so she can chew and whatever she wants. I mean, just wait until you see her. She's only in her temporaries. This was 2 days after surgery.
Nice.
I mean, look at the difference that this does to her face. I mean, look,
Yeah.
she's even done her hair differently. You can see the sparkle in her eye. Look at the smile. Doesn't look, struggled anymore. And these are just her temporaries. So before you know it, we're giving her her full set of teeth that are going to be fixed and supported with implants. And it's amazing how people forget how far they've come and where they started, and when they see themselves now, they say, this is really who I am. This is truly who I am.
Good. Yeah. We were talking in the green room about your mother. I said, what was it like before you fixed your teeth? Oh, it wasn't so bad. And then you started reminding her of how bad it was. Because they forget, right? They just know the new look.
Well, and that's so true. that is so true. Because anytime you go through some sort of a trauma, what does your brain want you to do? It wants you to forget about it, right? So
Okay.
we've moved past the trauma of the pain. We've moved past the trauma of the embarrassment, and we've moved on to better and greater things. So they only remember the good part.
So of the two types of patients that you see, the people with really bad teeth and they're headed for dentures, and then the other group, they're actually already wearing dentures. So when they go to your office, what are the dental implant options?
So the first option is, with 2 or 3 implants, we put little snaps on the denture so that the denture can snap in. So you don't have to use adhesive anymore. They can chew. Yes, it's going to wobble a little bit, but they can go back to chewing and throw out the adhesive. So they can eat salads and they can eat, a lot of different things. But of course it's going to wobble a little bit because there's going to be maintenance. The snaps need to be replaced. And that's going to be dependent on how quickly they become loose.
Okay.
But a lot of patients opt to do something that's going to be a little bit more stable, which is when we put 4 or 5 implants in, we stick a bar, and then the denture snaps in on top of that. That's going to be, a lot more rock solid. That way they can eat practically whatever they want because it's going to be a lot more solid.
You do a lot of those. I mean, you've done well over 100 of those, you said.
Yes, that's a very, very popular option, but they do come out at night, so they're not something that, they can keep in all the time.
But they can eat.
They can eat. Yeah, that's.
What about the upper? Because isn't the suction pretty
on
good
the
on the upper?
It's great. We can stick in 4 or 6 implants, do some snaps, and we can even remove the palate because that's generally what the biggest complaint.
On that upper denture.
Yes,
because it's covered.
That's the biggest
roof of the
complaint
mouth.
Because who wants plastic covering the roof of their mouth? It's not comfortable. You generally talk a little bit funny. You can't really even taste your food with that covering the roof of your mouth.
So it's much better. Now, what about the lower? Because I guess, at least it sounds like everybody wants teeth that don't come in and out. Right?
Yes.
You have a snap in, snap out option.
Yes.
So tell me about the fixed teeth that don't come out.
That's what everybody really wants. It's going to be a little bit more expensive, but those are the teeth that are actually going to stay in your mouth and not be removed. I always like to say it's a second chance at your natural teeth because it's not something that's going to rock on you. It's not something that you have to take out and put in a cup before you go to bed, but it's the closest thing to your natural teeth again, but without the pain.
How many implants normally to give them a brand new set of teeth that don't come out?
It's going to depend on the patient, but generally it's going to be about 6, maybe 5 implants. But we look at the patient and what it is that they're going to need specifically.
And it doesn't matter if they're 80 or 90 or whatever, they can do it.
Absolutely. Randy, that's the group of people that really benefit the most from this kind of treatment.
Now, I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer or a person happy with their teeth wearing dentures?
Randy, no offense, but why would they complain to you? I'm the dentist. I get all of the complaints. Okay, let me tell you what the life of a typical denture patient is.
All right.
They wake up earlier than their spouse because they don't want their spouse to see them without their teeth. They
tell you this?
Yes. They rush into the bathroom, they throw their teeth in their mouth, or they go to sleep after their spouse, or, they feel like they can't be as intimate with their spouse and, kiss them because they're worried their teeth are going to fall out. They can't laugh. They can't scuba dive. They can't, every single day they're worried about are their teeth going to fall out of their mouth.
Is this one of those things where they say, I should have done this years ago?
I hear this almost every day from patients that they wish they had done it. They couldn't believe how easy the procedure was, actually, and that they wish that they had done it, decades ago. Take my mom, for instance. She should have done this 10 years ago. She said she wishes. What about your dad? You were telling me about your dad.
He wore a denture for 20 years, and I forced him to watch one of my shows. Well, now he's got an upper and lower set of teeth that don't come in and out.
And that's been amazing. You told me he's a trumpet player.
He plays a trumpet. He's 84.
Yes.
And he says he bothers all of his friends that wear dentures.
Yes.
And he tells them, you've got to do this. You've got to do this. It took me like 10 years, and I said, I'll pay for him to even do it. He also exaggerates about everything, but he said that 2 minutes doesn't go by without a compliment when he meets somebody new. And he's a guy that loves to eat.
Well, that's embedded in our culture.
He's actually lost weight. I think it's because he's eating more fiber.
Well, that's embedded in our culture, right, Randy? That food's around every sort of social event, and if you can't eat and chew, it's holding you back.
You're kind of left out.
You're definitely left out.
So, are there young people like wearing dentures, like 40s and 50s?
Randy, there's even younger than that.
Okay.
We see patients sometimes that are, in their late 20s or 30s. Now, that's some of the most devastating cases because to be 30 years old and not have all of your teeth, is really sad.
But any age is too old to be wearing a denture. Because you don't like dentures. I mean, you do them.
Yes.
But ideally, you want them all attached to something.
Yes, because, a denture is not teeth. I always say, a denture is not a good replacement for teeth. It's a good replacement for no teeth. So if you want to have teeth that are like natural teeth, you need something that's not going to be floating around. And, can you bite with them? Well, sometimes, can you chew? Well, not really, only if, you happens to close and they touch. Getting teeth to actually, or getting dentures to actually chew and act like natural teeth,
it's very tough.
It's so rare.
Do you think if there was and I know this can't be done, but if you run an ad and say, hey, look, denture wearers, come in, try a brand new set of teeth that don't come in and out over the weekend, like a test drive.
Yeah.
Nobody could go back on Monday and say, give me my old denture back.
I've never had a patient who went through having some implants done who said, oh, you know what, I'd rather my denture. I have had patients who have told me that I can't believe I didn't do this before. Like, why did it take me so long to do this? Because it's really been, so life-changing for them.
Now, when they see themselves in the mirror for the first time, do they get emotional sometimes?
Oh, and I'm a crier too. So as soon as they look at themselves, they're generally crying. My assistant's crying. I'm crying. They're hugging. Everybody's crying. Yeah, I mean,
That's nice.
it's just a really amazing feeling. So it was about a month ago. We have a handyman, and he's the typical I fix everything, very manly. And when he took a look in his smile, I mean, he was crying like a little baby. He just jumped out of the chair and hugged me. He said he hadn't looked like that since he was a teenager. It was just. It was amazing.
So if you don't like your teeth, do something about it. I mean, this isn't for everybody, but if you don't like your teeth, do something about it.
I mean, if you don't like your teeth, let's do something about it, because there's so many ways that I can help you.
Now, what about the people that are, 70 plus on 5 medications or more? Can they still do this?
Oh, absolutely. So Randy, the first thing they come in for the consultation, we do a thorough medical evaluation. Sometimes we have their MD get involved as far as, changing some of their medications or, getting them ready for the surgery. But it's very rare that we have to tell somebody that they're not a candidate.
Now, what if somebody's been wearing a denture for like 20 years? Not enough bone to do this?
No, there's been so much technology in bone growing materials and bone building materials. I think that, I can't even remember the last time I told somebody that they didn't have enough bone, that they couldn't have
But is that a
implants.
common belief out there amongst patients?
It is, because sometimes if you go to a different dentist and they say you don't have enough bone, that may be true for that dentist and whatever kind of procedures they offer. But because of the technology that we have in the office with 3D imaging, with guided surgery, with bone building materials, I really can't remember the last time I told somebody that they weren't a candidate and that I couldn't help them.
Okay, good. Now you teach this, and we're like about a minute left, but you teach with this Mish Implant Institute. I
Yes.
guess it's known worldwide.
Yes.
Dentists from all over the world go and learn implant dentistry
Yes.
at this Mish Institute, and you're an instructor.
I am.
And you teach people. Are you like on some sort of a mission to wipe out dentures?
So we travel back and forth from the East Coast to the West Coast across the country. I'm helping teach other dentists these opportunities, what to do for these patients, how to help them.
Now, does it cost more to go to somebody that teaches other dentists how to do implant dentistry? And I guess you're working on a board certification for implant dentistry?
So, I have my diplomat in the International Congress of Oral Implantology.
Okay.
And actually it's going to cost the patient less because, of course, as you are more experienced, you have less complications.
Okay, good. Well, look, we're completely out of time. I want to thank you for coming on the show. Final message, though. Somebody watching this, they're of the two groups. Really bad teeth, but they know one thing, they don't want dentures. Then the other group are the denture wearers. And they've heard what you had to say, but they're still skeptical. What do you say to them?
I'll invite them in. Know what your options are. You shouldn't have to suffer in silence anymore. Come in and see what I can do to help you. It's a no-cost consultation.
Okay, good. And they get to meet you?
And they get to meet me.
And you laugh a little bit?
And we laugh and we have a great time.
All right, great. I want to thank you for coming on the show. Good stuff, good information.
Thank you for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.